Watch this.
We've seen a lot of records set these past couple of weeks in Idaho hospitals. Think things are bad now? Some state models say the worst is yet to come with the COVID surge in Idaho. Despite rising cases in the community, Boise State is now reversing course on its game day policies for all fans, from strict guidelines to, well, hardly any at all. It seems an odd hop, skip, and a jump to get here. So many of Idaho's coronavirus deaths could have been avoided, according to medical experts. But the misinformation about the disease and the vaccine has taken its toll, even among those in the same family, a situation Representative Greg Cheney has seen firsthand. In terms of the COVID situation in Idaho, we appear to be in the thick of it, the worst our state has seen. At the pandemic's peak, probably, or at least close to it. Crisis standards are now the norm in Idaho as we continue to see a level of COVID infections, hospitalizations, and deaths that keep rising. But are we about to turn the corner, maybe descend on the other side of this climb? It's a question we've asked a lot in recent weeks, and so have our overworked healthcare workers. Our peak is yet to come, however, according to Joe Paris and the state's new COVID model. He gives us insight on when we could hit our COVID peak and what that might look like.
Across the board, Idaho continues to struggle with COVID challenges. A major teller of that is new COVID data points.
The hospitalization numbers continue to set record highs. You can see in this chart that our number of patients in the hospital was at an average of 757 last week. That's a record. Our ICU patients was at 202 on average, again another record, and ventilator usage was at 131, more than double the previous high.
New data also shows a concerning trend for one demographic, children.
Weekly case counts among children are increasing more rapidly than our case counts among adults. In fact, infections among children have reached record levels in the past few weeks, and right now 20% of all new cases being reported are infections in children, which is much higher than what we were seeing this time last year.
So where are we headed, and when will Idaho hit its COVID peak? For starters, Dr. Catherine Turner, Deputy State Epidemiologist, says when looking at COVID projections, it's important to keep a few things in mind.
You can't really see how well a model worked until you look backwards, and we always say that projection is not predictions.
Turner explains it can be difficult to make precise assumptions about human behavior, and so projections should not be interpreted as predictions. With that said, here's the projected outlook for Idaho's COVID peak according to the state's model, which is a combination of multiple projections.
What it tells us right now is that we are tracking, in Idaho specifically, we're tracking at the high end of the projections. And so if it holds true, we could see in mid-November, upwards of 20,000 cases reported in a week.
Dr. Turner adds that hospitalizations could peak at 1,900 hospitalizations in a single week in late November, and deaths could also peak at 305 deaths in a week, also in late November. It's important to note that the model assumes that children under 12 aren't being vaccinated, but that could change if and when a vaccine is ready for them, thus changing the model. While it is wait and see, there is hope that Idaho could follow comparable states in the southeast that are also dealing with COVID surges. Dr. Turner says, assuming our experience is somewhat similar to other states that are now on the downside of their recent peaks, Idaho could follow suit. Here's what we saw. Cases plateaued in the southeast for a couple of weeks before declining pretty rapidly. There is hope that a similar pattern could soon happen in Idaho.
If we can all do the right thing and get those case counts down, and we won't see that sort of peak in mid-November, we'll flatten that curve, and we may still hit a peak in November, but it would be a lower number of cases.
All right, Joe, 20,000 cases a week by the end of November. It wasn't that long ago. Was it like back about a month ago, maybe a couple weeks ago? We heard August. Okay, so October, they were telling us we could see 30,000 cases in October, a week.
Yeah, so one thing to really point out with these projections and these models is they do change based on a variety of integers and different factors. So the model that we had earlier this year and also back in August, it's not necessarily wrong, but certain things have changed. For instance, the Delta variant is far more contagious, and we've learned more about how contagious it is than the Alpha strain. So that changes the model. The vaccine rates and the uptake, that may not have been exactly according to the model. So when you take a look at the projections and the models and the charts, there's a lot that goes into them. And if even one factor changes a little bit, the model itself also changes a lot. So there's also a big difference between projections and models than data itself. When we report daily case counts, that's the data that we have. The projections takes all the data from the state of Idaho and also regions that are similar to Idaho, and it kind of powers an equation to show this is what could happen if X, Y, and Z happen. But if something changes in the projection, Brian, the whole model does.
Well, so we're averaging about 1,200 cases a day right now. Are 20,000 cases a week. Are there that many people in Idaho to where this disease can still spread? That's my question.
The answer is yes, and our low vaccine rates are powering that entire situation.
Wow. All right. Those are numbers we're going to keep an eye on. Thank you very much, Joe. Boise State Broncos are going to host another home game this Saturday against University of Nevada, a rivalry game nonetheless. But the entry process for those wanting to get inside to Albertsons Stadium is going to look a little bit different for at least the students. University has reversed the requirement to have students show a proof of vaccination or a negative COVID test to get in. Now all they're asking for? Just masks, which is what they were asking for at the beginning. So why the back and forth with these protocols? Here's Katya Stepovic.
Earlier this month, Boise State implemented new COVID protocols for students just one day before the Broncos' massive home game against Oklahoma State to show either proof of vaccination or a negative COVID test. The decision came shortly after the state of Idaho declared crisis standards of care. Boise State says the goal was to have not just students, but all fans comply with this new guideline for the October 2nd home game. But now Boise State is reversing that decision. The university now saying that neither students nor the general public will need to provide proof of vaccination or a negative COVID test to enter the stadium. On Friday, the university said they decided to ditch those protocols because COVID case counts were down within the campus community and their campus vaccination rate was up around 88%. But earlier this week, they followed up to say they couldn't follow those protocols because they violate Governor Brad Little's executive order on vaccine mandates. That order says that the state entities, including colleges and universities, cannot require only proof of vaccination. While students had the opportunity to show proof of vaccination over negative COVID tests, the university must be able to offer every single person entering the stadium a test to be in compliance with that order. The problem? BSU says they don't have enough COVID tests for that. A statement from the university reads, because Idaho case rates are so high, state testing resources are being used to test individuals who are at high risk, including children under 12 who aren't eligible to be vaccinated and those who, due to underlying health conditions, cannot be vaccinated, individuals who have been exposed, and those who are symptomatic. The university will now shift from testing everyone in the student section to randomized testing. Their extra test kits that would be used on the rest of those students have been given to K-12 teachers, students, and staff. Because testing capacity is strained, on-campus testing will also be minimized to only those who are at high risk of contracting the virus or have had exposure.
And as we've reported, there's been quite the run on rapid tests across the country and especially here in Idaho, specifically with our local school districts. And Boise State says that's made it extremely hard to get any extra tests to use for non-symptomatic cases. And as we've heard, proof of vaccination is allowable as an alternative to a negative test, but not standing on its own. Brian.
And I get not wanting to waste these rapid tests at a football game for something that many people may not think is really serious enough to use them for. But what about, okay, so they're going back to this mask requirements. That didn't go over so well the first couple of games.
Right, and it's more important arguably now than ever before. And the university says they're actually brainstorming ways to improve compliance with that mask wearing, like maybe including incentives of some sort to wear one. But they do admit, Brian, that it's just not an easy problem to solve. Last game they gave incentives, somebody got part of their tuition paid for, and another person got a lease on a truck. So there are some pretty good incentives out there at Albertsons Stadium. 25% off tuition, I believe. So yep, that's it's a big chunk. All right. Thank you very much, Katya.
Just days after getting sick, this Caldwell lawmaker's mother died from COVID. Now he's hoping his story will help other families learn to talk about their concerns about the vaccine. All right, here's what we're hoping for questions from you. It doesn't have to be COVID related either. We like all kinds. Whatever it is, just text it directly to us. 208-321-5614. You can also send us your comments and, yes, even your complaints. Just include your name and the hashtag #the208. We're going to share as many as we can at the end of the show. Earlier this week, a St. Luke's doctor who has been letting the public know how his health system has been handling the Delta surge of COVID-19. He's been keeping us updated on the record number of patients, the ICU numbers, how many unvaccinated. Well, on Monday, he tweeted out 300 plus COVID patients, and all of them in the St. Luke's health system in the ICU there were unvaccinated. About 45 minutes later, Representative Greg Chaney from Caldwell retweeted Dr. Kavanaugh with this: "My mother passed away last Monday from COVID-19 in the ICU. Being unvaccinated was her choice. But those making that choice don't just put themselves at risk, they strain their families and place non-COVID patients at risk by diverting care. Please get vaccinated," he said. It got a lot of people's attention, including ours. Representative Chaney told us his mom, Judy Page, was 74 years old and was living with his sister, who is also unvaccinated. Well, she and her husband contracted coronavirus, and a couple of days later, his mom, Judy, became ill. That was around Monday, September 13th. By Saturday evening, Judy was disoriented and sick enough to be taken to West Valley Medical Center's emergency department, where she was admitted to the ICU hours later. It took a couple of days to get her there because at first she didn't want to go because of, well, misinformation she's read about crisis standards of care. Monday, Representative Chaney spent in court doing his day job as a lawyer. By that afternoon, things were looking up for his mom until they weren't. By Monday evening, doctors doing all they could do were giving her morphine and not much of a chance. Chaney said he made it to the hospital by 7:15 that evening, and by 7:30, his mom Judy had passed away. His mom's story, his family's story, is not unique in Idaho. A conservative family sharing a conservative upbringing, but they don't share the same outlook on healthcare or the pandemic. Representative Chaney says his mom was skeptical from the beginning.
I think that she was skeptical about whether it was really as bad as it was billed to be. I think she kind of viewed it as, hey, I've been through a lot of stuff in my time on this planet, and this is just another thing in the stuff box.
So like a lot of families, I'm sure, in Idaho, I mean, there are factions. There's split. There's a holistic side, as you're mentioning, and then there's those that kind of go with the traditional Main Street kind of medicine.
Right.
That's your family.
That's my family, absolutely. Opinions as broad and diverse as they can be, and I think there was a natural skepticism. She wasn't gullible, and that's, I guess, one thing that I've tried to make clear is, I mean, she was the first in her family to graduate with a bachelor's degree. She got a master's degree. So she was an intelligent person who, she made her own decision. It was her decision, but she was naturally skeptical.
About what?
About everything. And I think that what would have normally been a natural, healthy skepticism, perhaps, there was enough out there in the atmosphere online, on social media, to feed a natural skepticism beyond the point at which it should have been abandoned when it came to the vaccine, I think.
So you think she was misled by misinformation?
I think she was, and I think, once again, it was her choice. I don't blame anybody else for that choice, but I think there was enough out there that validated her skepticism.
And it's that skepticism that led her to not get vaccinated?
Correct, yeah.
But you didn't ask her about it?
I didn't ask her about it. I was very open about having gotten vaccinated myself. She was more of the attitude that, she was tough. She'd handled a lot of stuff in the past. I never point blank said, "You need to get vaccinated." Maybe I should have.
Do you regret that?
I do. I'm not sure, frankly, if it would have made a difference.
You don't?
I don't know if it would have made a difference, and I don't know if a mandate would have made a difference. Mom became good at a lot of things during her life, but being told what to do was never one of them.
What's been the hardest thing about the last few weeks for you?
I guess, again, I don't put her decision at anybody's feet but her own, but there is a little difficulty there reconciling. She passed, but she chose this path, and that's, and you don't want to necessarily be angry at her, but the idea that she made that decision kind of messes with your brain a little bit.
Do you think people in power, the elected officials, do you think there should be a stronger stance taken by them? By people in your position?
I think the messaging needs to be clearer. I think there are a lot of very irresponsible people out there just helping disseminate nonsense.
So the messaging is what needs to be remedied?
The messaging is absolutely what needs to be remedied. It's not virtuous to spread misinformation. And if there's political benefit to it, it's going to keep happening. It needs to become a political liability. I think that there are those out there who know better and are saying it anyway, and then there are those who, even in positions of, even elected officials are sincere believers in the misinformation because they themselves have been deceived. But there's a good number of them that know better.
What do you want people to take away from your story, from this story of your family?
Every single thing that happened was preventable, 100%. And there's no reason to put your family through something like this, or to put your neighbors through diminished care for something that's absolutely preventable. And people need to get vaccinated.
It took less than a week from getting sick to dying. Representative Cheney says he understands how dire, he didn't understand how dire his mom's situation was at the hospital because things started to look up by mid-afternoon on Monday. But by the time he was told that he needed to be there, it was too late for him to even say goodbye to her. He told us he hasn't spoken to his sister about getting vaccinated, about her getting vaccinated, but he says he senses there might be a slight change of heart after this experience. There may also be some of you out there who are just thinking that we are stoking the flames of fear by telling you these stories. But we're merely just telling you what is happening, and that is happening a lot right now. Hospitals and their ICUs are mostly filled with unvaccinated COVID patients, and they're getting younger, and they are dying. Representative Cheney told us today when his father passed away last September, not from COVID, his funeral was scheduled for 6 days after. For his mom to arrange a service through a funeral home, they were told they were going to have to wait 3 weeks because there's so many in line.
I mean, obviously there's some speculation that he was on the run. Certainly not on the run. We'd been in contact with officials the entire time.
For the first time since an arrest warrant was issued, we're hearing from Aaron Von Ellinger's attorney. You have something you want us to look into? Something deep? Something historic? Tell us about it. 208-321-5614. Don't forget to include your name in the hashtag, the 208.
Our thought was it took 6 months for this investigation to happen, and well, basically it appears to have taken, because I know the report was completed in March. The warrant doesn't come out till the 6th. Our thought was that, what's 2 more weeks in order to get him back?
What's 2 more weeks? Asks John Cox, the attorney for former state representative Aaron Von Ellinger, who was accused of raping a 19-year-old State House staffer earlier this year. What's 2 more weeks? According to Cox, Von Ellinger hasn't been in Idaho for months, wrapping up a 4-month-long Central American vacation when that felony arrest warrant was issued back on earlier September. This vacation, Cox says, was known by prosecutors. So what's 2 more weeks? Well, the accuser may have something to say about that. Today, Cox held court with members of the media per his client's request to clear up some confusion, Cox says, adding his client being out of the country didn't mean he was running from the law, rather just on vacation with his family and attending to business matters in parts of Central America. Which parts? Cox wasn't sure. Cox says he was contacted by Von Ellinger 2 or 3 days after that warrant was issued. He then reached out, or Cox did, to the lead detective on the 12th or the 13th, telling him that Von Ellinger was outside the country, had been since May, but had planned to return on September 24th. Somewhere along the way, Von Ellinger missed a connecting flight and ended up flying into Atlanta Saturday night, the 25th. There, he was arrested and is being held currently in the Clayton County, Georgia jail, charged with being a fugitive of justice. But Cox says the warrant was supposed to be a bail and release warrant, meaning you get booked and then you get released on bail. Instead, he says confusion has led to his client being stuck in Georgia.
He knew this could happen, but again, he was always ready, willing, and able to comply with the warrant. It's just he had been there for some time, and once he learned, made contact, and we tried to work through this. He is continuing to be, and has been since my conversations with him about he's adamant that he's going to fight these charges.
The bail and release part of the warrant apparently didn't make it to the judge in Georgia, who denied bond to Von Ellinger when he appeared before him on Sunday. Now, according to Cox, Idaho has 30 days to retrieve Von Ellinger from Clayton County by plane or by automobile, a transport van that would be delivering people in a similar situation. So lots of stops and drops along the way. Or, Cox says, the Ada County prosecutor could just let Von Ellinger sit there for 30 days and be released to make his way back to Idaho on his own, where he will likely face a grand jury. So what's 2 more weeks? Well, maybe the question should be, what's 25 more days? All right, final segment of the show. An anonymous viewer wants to know what happened to my body, my choice. I understand we live in a society with norms such as speed limits, not driving while intoxicated, but vaccine mandates are crossing a line. I do not need a vaccination. Forcing people to choose what's best for the health care is wrong. You might as well stop reporting on COVID numbers, says Susan L. A meridian, the opposite side of this spectrum. People just don't seem to care. They have no feelings for all of the overworked people, healthcare workers. They don't care if they infect others. It's just sad, she says. See you back here tomorrow.